Hi, my name is August West. My mom is camera shy, so she asked me to tell you about serotonin syndrome. Serotonin syndrome is the result of excess serotonin stimulation of central and peripheral serotonin receptors. This can occur due to excess serotonin precursors or agonists, increased serotonin release, decreased serotonin reuptake, or decreased serotonin metabolism, often caused by the administration of serotonergic medications. Serotonin syndrome generally occurs within 6 hours of a change in dose or addition of medication. It is just as likely to occur with therapeutic doses as with overdoses, making it very difficult to predict when a patient is at risk. Serotonin syndrome is classically associated with a triad of symptoms: mental status changes, autonomic instability, i.e., tachycardia, hyperthermia, hypertension, and neuromuscular abnormalities, hyperreflexia, myoclonus. Unfortunately, not all patients present with such clear symptomology. Serotonin syndrome is often a diagnosis of exclusion after ruling out neuroleptic malignant syndrome, anticholinergic toxicity, and malignant hyperthermia, which may all present with similar yet distinguishable symptoms. If not properly identified and addressed, serotonin syndrome may result in significant complications, such as seizures, rhabdomyolysis, metabolic acidosis, renal failure, cardiac failure, and disseminated intravascular coagulation. Additionally, patients with serotonin syndrome are at an increased risk of death in environments with higher ambient temperatures. Serotonin syndrome is generally known to be associated with combinations of medications that have serotonergic activity or augment serotonergic function. Serotonergic antidepressants, MAOI, SSRI, SNRI, TCA, are common culprits associated with serotonin syndrome, especially when given at high and frequent doses, with other serotonergic medications, such as triptans or other antidepressants, or with other medications that alter their metabolism. Medications that are at high risk for serotonin syndrome are MAOIs, mirtazapine, nifazodone, SNRI, SSRI, TCA, and trazodone. Medications that are at moderate risk are bupropion, buspirone, cyclobenzaprine, lithium, and opioids. Low risk include amphetamines, atypical antipsychotics ondansetron and valproate. One common culprit associated with serotonin syndrome that often goes unlooked is OTC medications, especially herbal supplements. Some OTC medications that are associated with serotonin syndrome include dextromethorphan found in cough syrup, ginseng, L-tryptophan, and St. John's wort, and 5-HTP, which are over-the-counter herbal supplements. There have been case reports published demonstrating the role herbal supplements can play on the development of serotonin syndrome. Serotonin syndrome may not be obvious to recognize, presenting the opportunity for rapid progression and severe complications. Point 4. Additionally, it can be difficult to predict which patients are at risk for developing serotonin syndrome. The role of OTC medications and herbal supplements in serotonin syndrome is not clearly defined, and case reports are the best evidence available at this time. It is imperative to obtain accurate and up-to-date medication lists from patients, including the recent use of herbal supplements. The use of OTC medications has historically been underreported by patients to their medical providers. Patients taking serotonergic medications should be monitored and symptoms of serotonin syndrome kept in mind. So that is all I have on serotonin syndrome. Be sure and tell Mom what a great job I did, because I think I deserve a treat for this. Bye for now.